Every expectant mother hopes that her pregnancy goes well and that her baby will be born healthy.
But sometimes it cannot be helped that babies are born with congenital conditions that may put their lives at risk.
And as mothers, we need to know the best way to treat and manage these ailments.
Because you should always be actively involved in matters as important as your child's health.
In this show, we are free to ask what we want to know and say what we want to say.
Because as patients, the more you ask and talk, the better we doctors can help you. Your health really depends on you and me. I'm Dr. Oyi Balburias.
I'm Maricel Laksa Pangilinan, and it's time to
Talk to Doc.
Doc Oyi, what are the birth defects that are most common among infants?
Well, if you're talking about congenital heart defects, we have like two subgroups, like you have cyanotic and acyanotic. Well, the most common is what we call ventricular septal defect. This specifically means that there's a hole in the heart of the baby. So there are different kinds. So one is cyanotic, meaning this is what they call the blue baby. So blue babies, because, well, normally our heart will pass there the blood so that it can be oxygenated once it passes through the lungs and then goes back again to the left side of the heart. But sometimes because of defect, the blood that does not contain oxygen and the blood that contains oxygen are mixed up, so resulting for the
baby
color
turning blue.
Yes.
Okay. And that's exactly the pediatric heart condition of our featured patient, and here is her story.
Eder Ferrer may seem like a normal kid, cheerful and loves to play. But before all these, she was diagnosed with a heart disease called transposition of the great arteries when she was born. Transposition of the great arteries, or TGA, is the most common cyanotic congenital heart defect among newborns. This condition refers to the abnormal development of the heart during the first 8 weeks of pregnancy, wherein the large vessels that carry blood away from the heart are not properly connected.
Yung arteries niya magkabaliktad. So, it's called TGA, or transposition of the great arteries. So, we have two options. The first one is lalakihan yung butas nung pinagdadaanan ng oxygen. And then the second option is paoperahan siya. Nung gabi din na yon, Dr. Cheng said baka hindi umabot si Eder the next day. So, he had to do yung pagbutas nung heart, nung daluyan ng oxygen.
Right there and then, Eder's attending doctor, Dr. Dexter Cheng, performed a balloon atrial septostomy on her to enlarge the small hole in the upstairs room of the heart for better oxygen flow.
Sabi naman niya sa akin, Berna, okay si Eder. Sabi niya, I think she'll make it. And yung ginawang procedure ni Dr. Cheng nung una, okay siya. So, mas makakatulong. But then, mahirap kasi tanggapin. Ang masakit kasi, yung sinabi niya na kung yung unang procedure lang ang gagawin, hanggang 13 years old lang siya. So, parang sinabi na, tinaningan na kagad na hanggang 13 lang siya. Ngayon, kung if you do the operation, if she'll make it, hanggang 65 years old kaya.
3 days after the septostomy, Berna decided that baby Eder should undergo an arterial switch operation to correct the defective connection of the aorta to the pulmonary artery of Eder's heart. With the help of the medical specialists, treatments, and of course prayers, Eder survived the surgery and is now playing with her mom.
Parang normal kid na makulit na, tapos magulo. Parang kung if you won't see her stitch sa dibdib, you wouldn't know na pinagdaanan niya lahat yun. After ng 1-year-old niya, magto-2D echo ulit siya. So, titignan lang niya kung how the heart is doing. So, pagkatapos, siguro in 1 or 2 weeks time, magto-2D echo ulit siya. So, sana okay na okay na okay. Kasi kailangan nila makita yung wound, kung ano yung nangyari. Tapos kung yung heart niya okay naman. Pero so far, as in, parang normal child siya.
Ida recently celebrated her first birthday, and Berna's wish is for her daughter to grow brighter and healthier.
Doc Oy, is there a better way of diagnosing something like this, what Ida had before being born?
Oh yes, that's the value of congenital screening. No? So that's where the value of prenatal or having a regular prenatal checkup, because your OB can recommend it, or sometimes even the parents are the one are asking for it, especially if there's a genetic history in the family.
Those checkups are really important, and well, baby Ida is fortunate that her heart condition was attended to right away.
We'll talk to the cardiologist who was in charge of her case after this break. Stay tuned, we'll be right back.